So I have had a few people ask me some very good questions about the books that I read that supported How to Eat to Live, or things that had scientific connection to the truth that's in How to Eat to Live. That's the way I would put it, because I never needed anything to prove what was in How to Eat to Live after all the study that I did. And then, reading How to Eat to Live. How to Eat to Live is what changed everything. But I'm just going to show you all some books that I read that were kind of bearing witness to what the Honorable Elijah Muhammad said. So here's one, Charles Esselstyn, Prevent and Reverse Heart Disease. Excellent book. He has a lot of recipes. I really don't get into a lot of recipes because he used soy and other things. But as far as the research and the knowledge on the heart and how our diet can affect the heart, excellent book. Next one was a China study. This man did a lot of research in China. And, we always consider people that live in the countryside of China as the longest living. So he did a lot of research in here dealing with cancer and diabetes. So T. Colin Campbell, the China study. This is one I've mentioned recently in one of my programs, Your Body's Many Cries for Water. Dr. Batman Geldy, excellent research. Here's his other book, Obesity, Cancer, and Depression. So he did a lot of research on water and how important it was to be hydrated and the difference between hydration and drinking regular water. This one talks a lot about the experimentation on black men and black people in general, but especially the prisons, black and brown people, how they were destroyed for a lot of the stuff that we use on skin these days. Medical apartheid. This is probably one of the most important reads I ever had in my life. Probably during the process of going through medical school, if I had read this, I might have quit, just because of the horror that this medical system has represented towards black people. This is a book right here that will make the Tuskegee experiment pale in comparison to some of the things that have been done to black people. But an excellent read. Make sure you have a dictionary, because this sister has one heaven of a vocabulary. And her second book, Deadly Monopolies, talks a lot about the financial and economic systems that have taken over medicine. So those were the early books. After I read How to Eat to Live, it was just extremely changing my life. And those are the books that just happened to piqued my interest, or people suggested them to me. Here are the books that I read early in my desire, of course, coming out of medical school, was to immunize all children in Houston. And it was these two books and the testimonies of some mothers that made me start to seek new information. And so these were the first books that I read that were talking about some of the truths of immunizing your children, and some of the secrets and some of the dark lies and secrets about immunizations. Most doctors have never read anything like that. All they've ever done was gone by the propaganda of the medical industry, and so that opened my eyes to a lot. This was something that was a read in medical school, and so I've always used this to continue to make sure that I'm staying grounded in some of the stuff that was in early education. It's very important to know. So it's important to know the beginnings of how the body works, and then a lot of times you can trace back to how diseases are processed, and then how the body builds itself and fixes itself and grows itself, what's first, and all those type of things. It's very important when you're thinking and trying to put together all of the information that you're reading. Here are a couple of more nutritional herbology. Had this for most of my life. As I've said recently, I never really talk about this much, but I am a master herbologist. A lot of research over the years. Here's a good book that I got recently, Beating Cancer with Nutrition. And I shouldn't say recently, I reattached to it recently, but I read some of this like when I was back in high school or college, one of the two. I don't remember so far along. Here's an excellent book on apple cider vinegar my cousin gave me years ago. And the rest of these books are more recent reads. The Biology by Leaf by Bruce Lipton, excellent book on having positive and meaningful thoughts that project what's going to happen in the future. Joe Dispenza, You Are the Placebo, excellent book. There's another one, is Breaking the Habit of Being Yourself and Making a New One, something like that. But those are both very good books. Recent read on thimerosal and this serious problem that's going on with young black boys and autism coming from these immunizations, especially the trivalent MMR. This right here, you got to have in your library, because as I've said before, based on the book Medical Apartheid by Harriet Washington, there's been so many experiments that have done on black people. The things that we do know pale in comparison to what the truth is. And Dr. Wesley goes into a lot of details about the type of things that have been going on behind the scenes that most people typically don't have any information about. And I would also suggest getting his latest, The Pot Plot. That's going to be on my list soon. This is something that I highly recommend. The truth is that because of black people's history in this country, a lot of people really can't teach us well. It takes people that have gone through some of our suffering and understand some of our suffering to help us. And that's why I think this book is extremely important. A lot of us are educated in certain areas, and the other parts of our lives show that we don't have much knowledge, wisdom, or understanding in other aspects that are not doing that well. But this one right here, as far as raising children, excellent read. As soon as Ramadan is over, I'm going to get back on that, finish that. And then The Deepest Well, this is some very interesting read here. The sister did a lot of research on the type of health problems that typically affect people in poor communities that are exposed to low nutrition and exposed to a lot of violence. So that definitely is on the reading list for after this Ramadan is over. One thing that is missing that you all didn't see is African Holistic Health by Layla O. Africa. I think somebody stole my book, but that was one of the early reads that I did. Very important. As I always say, I stand on the back of Layla O. Africa, Dr. Alim Muhammad, and Dr. Sebi, and Dr. Afur. These are the people, the black people that stood up to America. And there are others, but these are the ones that influenced me. They stood up against a system that has never been proven to be our friend. And they stand on what they do. They gave our people options, and they inspired me. So Layla O. Africa, African Holistic Health, I would put in my repertoire as well, because that was a very good read. And again, I will finalize this statement saying I appreciate all of you all that support. I appreciate all of you that ask these type of questions. I appreciate all of you that are taking the advice and starting to do some things different in your life. That's why I do this. And lastly, I will say that How to Eat to Live is the lens of which I look at through all of these books. So when I read one of these books, I am trying to find how closely this book is associated to How to Eat to Live. Because why? How to Eat to Live was the thing that opened my mind, opened my ears, and opened my ability to understand things to a whole different level. And then everything else that I've studied over the years pales in comparison to what was in that book. And so that's why it is the lens by which I use. So of course, get How to Eat to Live, book 1 and book 2, read those. And then when you read all of these books, you will, I think, be very, very armored with the type of information that could help you always stay in control and stay empowered to take control of your health. So thank you all. Hope this helps. Get your library up. Peace.